Hey everybody, welcome to Business Savvy Physicians 9 Steps to the Perfect Consultation for your med spa. Step 1, establish credibility. It's super important to explain why your med spa is different than the med spa down the street. If you have different things you offer, then explain that to them. Also explain how long you've been an esthetician, a nurse practitioner, whatever your credentials are. It's important to let them know that as well. Step 2, find out your patient's needs and their goals. What bothers them the most when they look in the mirror? Make sure you give them a mirror to look at so it reminds them, when I look, this is what drives me crazy the most, right? Make sure you ask them those questions. Number 3, analyze their skin, look over their history, ask them what they've done in the past. What things have they tried? What other med spas have they been to? Where have they gone, right? These are super important questions. Ask lots of questions. Overall, you want them to be talking more than you. Step 4, discuss options that would help them achieve their main goal, okay? Show them before and after pictures. Explain what it does. You don't want to go into too much detail if you see their eyes start to glaze over. Pay attention to your patient. Step 6 is to create a personalized treatment plan just for them. You're going to be writing this down. You're going to write down what procedures you recommend. You're going to say how often they need to do it and every X amount of months. So for example, we want you to do, Morpheus, and you need to do it 3 times to get ultimate results every 4 to 6 weeks apart. Okay, you need to use what they need, how often it needs to be done to get optimal results, and it happens every however many times apart from each other. Okay, you're going to give them a treatment plan that's 6 months down the road, right? So don't be afraid to put a lot of stuff on it. This is something they will get to look over, and they can do it as quick as they want or as long as they want. It gives them a plan. That's what it's called, a treatment plan. So you're going to present them with 3 options. The first option is going to be, how do they achieve their goal the quickest in the shortest amount of time? Money's no object. Do not assume that you know what somebody can afford or not. That's not your job. Your job is to present them with ways to achieve their goal, right? So make sure you're looking at everything and figure out the optimum results to get there the fastest. Number 2, if they had to take something away, it could be this. And number 1 is going to take them the longest, and it's the cheapest way. It could be a pay as you go. I would start with this, and this is going to take, this amount of time, and you're going to do it every 4 to 6 weeks, right? Then step 7 is going to be always add an at-home skincare plan. Find out what they're using. What kind of regimen are they using? What skincare line are they using? They don't do a skincare line or they don't do a regimen. Ask them, are you washing your face? Do you use a moisturizer? Because that is somewhat of a regimen, okay, whether they think about it or not. So when you're presenting back to them, you can give them a better product in the same amount of steps that what they're already doing. A great face wash, a great, a great face wash, a great moisturizer, and maybe a great eye cream, things like this. All right. So kind of swap out the products that they're using for the ones that might work better. Tell them just push the products aside and use yours. But every treatment, skincare treatment or treatment plan that you offer needs to have some kind of a home skincare plan. Put those products on it as well. Make a copy so the patient can take their copy home. Think about it. Make sure they have pricing. And then you keep it and put it in their chart so that you know what you recommended the next time they come in. But step number 9 is super important. Ask them what they're thinking. Ask them where they would like to start. Ask them, do they want to go ahead and start with a procedure now? Do they want to rebook and start with a procedure? Do they want to take it home and think about it? Just because somebody doesn't book with you or do a procedure with you right then doesn't mean it's a bad consultation or a failure. Make sure you follow up with them in a week to check on them and to say, hey, have you given it any more thought? Sometimes people don't like to commit right then. That's okay. It doesn't mean it's bad. But when you give them a perfect consultation with a treatment plan and steps, they're a lot more likely to come back to you because you took the time to write out everything they need, what it's going to cost, and give them a plan, because it just makes you look more like the expert. I hope this helps you close business. Thank you so much. Make sure you follow me for more information.